We're quite unique as a species in that we don't simply have sex for reproduction. We do it for enjoyment, pleasure, love, intimacy.
We need relationships as a baby to survive, but as adults, we still seek relationships, and I think that's for our kind of emotional survival.
Once people move beyond an age where sex isn't about reproduction, then I think people often start to think, why is it that people are engaged in sexual relationships?
Why is that strange? We have to make sure people understand that it's not strange. We all vary when we're young, we vary when we're older. Let's rejoice in this.
Too much is placed in people getting old and therefore not enjoying sex, when sex is the most enjoyable activity you can do together. It helps you keep young and active.
I've been married for 60 years and we've had a lovely sexual life and still have cuddles. It's great fun.
I always had a healthy sex life until I got older. I find it more difficult now, but I still have my moments.
I think that young people should be made to see that love and sex for older people is normal and not a joke.
We were talking about this in the office this afternoon before I came, and people were getting a little bit giggly. So I said, what do you feel about your parents having sex? And it was like, oh, I can't think about that. So I said, well, what about your grandparents? Well, that was just a no-no.
I think we need to get rid of the taboo around sex and older people, and we need to make it a lot easier for people to talk about sex, and that includes people in general and the medical profession and teachers in schools.
We're much healthier, we're living much longer, and we're hopefully having much fulfilling relationships. And I think that we need to raise the awareness that sex and intimacy is really important, because society actually makes you feel that once you're over 50, you shouldn't even be thinking about sex, let alone actually doing it. And of course, that's not the reality.
It's important we talk about it because there's a form of anti-age discrimination which we're trying to make people understand that as you get older, you're as different from the next person as younger people are. So there are people of all shapes and sizes and ways of living.
This research came around a number of years ago when I led the effort to put in a comprehensive sexual health questionnaire into the English Longitudinal Study of Aging, or ELSA for short.
We really wanted to explore this from the older person's perspective. What did older people really want to say about their sexual relationships, and how could we address that as healthcare professionals, and how could we get that wider message out into society?
So from the questionnaire, we found that over half of men and a third of women over the age of 70 were still sexually active. And of those sexually active people, around a third were reporting that they had sexual intercourse at least twice a month. So there's a significant minority of older people that are still in different ways sexually active. People who are more sexually active, more sexually satisfied, had higher levels of happiness and well-being in our survey. Now, I'm not saying that good sex leads to happiness or vice versa. I think they probably run in parallel together. But trying to take sexuality away from happiness and well-being, I think, is a mistake.
So the research is important, I think, on three levels. So I think it's important, first, in order to correct those kind of stereotypical accounts of sex in later life, of sex generally, but sex in later life particularly. So the research is completely novel in doing that. I think it's also important from a scientific point of view. And so there is this question of how sex lives vary across generations, what that means, and so as the golden baby boomer generation grow older, will their sex lives be different? And then there's also the kind of public health question. People's sexual function varies as they grow older, but if sex is really important to people's lives, which we show it is, then it's also important to try and do something to correct any dysfunction that they might have in their later lives.
The NHS seems reluctant to help with sexual problems in someone of our age. Penetrative sex is incredibly painful, and I have been advised it's due to my age.
I take various medications for heart problems and diabetes, which does affect my sex drive.
Since the menopause, I've had no sex drive. It doesn't worry me, but I want to keep my husband happy, so we do make love. But kissing and cuddling is very important, and having a sense of humour, and being kind to each other.
I wish my partner would seek help. We've talked about it, but it ends up in a row, so I don't bother.
It's really important in terms of services that are supporting older people to think about the broader construction of health and well-being.
A lot of services, a lot of sexual health provision is geared very much towards younger people. But the reality is that older people have sexual health needs as well.
There's a lot of help for problems which are related to sex. And if doctors aren't comfortable talking about sex, then they may not tell their patients.
In general practice, teaching is called the doorknob phenomenon. So people come in and have a list of several things that they want to discuss. And GPs in the UK have about 9.22 minutes for a consultation. So that makes it a very cramped space to talk about more sensitive issues.
I think in practice, healthcare practitioners don't think about addressing issues of sexuality and intimacy with the people that they're supporting and caring for, and we need to overcome some of those barriers and challenges.
I think some of the changes that could be implemented within practice today is perhaps some training for healthcare professionals such as practice nurses, so that there's confidence there to have the ability to talk about sexual health needs.
There should be more focus on continuity of care. And I think that's disappearing in the UK, in primary care at least. So have an ongoing relationship with one trusted provider.
We can make a real difference because we can raise awareness. We can tell people that it's okay, that you definitely should be having sex and intimacy in later life, that it's okay to speak to a health professional, it's okay to mention it to your kids or your relatives, and it's okay to say everything's not going all right and I need some help.
We solve this problem best by not being frightened of discussing it, by helping people who work and know older people. If you're talking to the general public who have parents or relatives who are older, that they may continue a good life sexually.
Because if you listen to the testimony of people as they get older, what it shows that this is a really universal issue that impacts on the well-being, on the health, of the happiness of older people. And it's something that those of us in public health and in public services really need to think about getting our act together.
I think in 10 years' time, I would hope, with continuing research such as ours, that the conversation would become more open, particularly between generations, with a realisation from younger people and older people alike that there isn't some arbitrary age where sexuality stops. It's important for all adults, irrespective of age.
Many older people enjoy a really good sex life. There's no point in being shocked about it just because they're old. Younger people do as well. Older people are just the same people tomorrow. That's okay. Let's just make it okay.